Consent to participate in the evaluation of the EPIC SNAP ENT program. The U.S. Department of Agriculture Food and Nutrition Service is trying out new ways to help participants in the Illinois Department of Human Services SNAP Employment and Training Program. It is also doing a study to find out if these approaches can help people get a job or get a better job. A team of evaluators at Mathematica Policy Research, MDRC, Cone Consulting, Insight Policy Research, and Decision Information Resources will conduct the study. By signing the consent form, you agree to take part in this important study. In the study, the following will happen. During registration, we will ask you to tell us about such things as the number of people in your family, including children, your race or ethnicity, and education. We will ask about employment, use of public assistance, and your health. This information is required to be part of the study. We will also ask who the evaluation team may talk to, who might help them get in touch with you over the next few years if we cannot reach you by phone. You do not have to answer the questions about any other names you have gone by or provide information on relatives or friends who may know how to contact you if we cannot reach you directly. Information you give us will be sent to the evaluation team. A computer will put you in one of two groups. This is a little like a coin toss. It will be decided by chance. Each person has an equal chance of getting into either one of the groups. The two groups are EPIC SNAP ENT Services Group or the SNAP ENT Services Group. If you are in the EPIC SNAP ENT Services Group, you will be able to get services through the EPIC SNAP ENT program, which will include some newly available ones. These services could include an Individualized Services Training and Employment Plan, or ISTEP, your Personal Career Navigator, basic education assistance with reading, math, and English as a second language, if needed, adult education, or GED, and career technical education, training to obtain industry skills and credentials recognized by local employers, paid work experience, and supportive services including transportation, work uniforms and supplies, permanent job placement, and retention. In order to meet your work requirement obligations, you must continue to engage in EPIC SNAP ENT services for the next 3 years, and you cannot choose to receive regular SNAP ENT services instead of EPIC SNAP ENT services, if EPIC SNAP ENT services are available. If you are in the SNAP ENT services group, you will be able to get services through the regular SNAP ENT program, if available. These services could include an individualized employment plan, a referral to basic education and vocation education providers, alignment with public and not-for-profit organization for unpaid work experience, self-identified community work, job search, readiness and retention activities, and supportive services. You will not be able to get the services newly available through the EPIC SNAP ENT program for the next 3 years. Participation in the study is voluntary. It is up to you to decide to take part in the study. Whether you take part in the study or not, you are still required to meet your work requirement obligations. If you do not want to take part, you will only be able to receive regular SNAP ENT services if available. Unless you join the study today or at a later date, you will not have a chance to receive the services newly available through the EPIC SNAP ENT program until 2019 or later, provided they are still being offered then. Deciding not to take part in the study will in no way affect your eligibility for SNAP benefits or regular SNAP ENT services if available. If you take part in the study, you have a chance to get the newly available services mentioned above. We also will learn if this new program works, and that may help you and others receiving SNAP. If you take part in the study and are randomly assigned to the EPIC SNAP ENT Services Group, you will be eligible to receive those services until 2019. If you agree to take part in the study and later you wish to remove yourself from the study, you can do so at any time by calling the study toll-free number at 1-844-288-5645. But you should attempt to contact your current SNAP ENT or Epic SNAP ENT service provider and inform them of your decision to leave the study prior to doing so. If you remove yourself from the study, any information the evaluation team has received about you before that time will be used for the study. If you remove yourself from the study, you will not be eligible to receive Epic SNAP ENT funded services until 2019 or later, provided they are still being offered then, even if you had been put into the Epic SNAP ENT services group. Information collected as part of the study will include the following. Over the next few years, a person from Mathematica or DIR may ask you to take part in no more than 3 telephone surveys up to 5 years after today. Participation in these surveys will be voluntary, and each survey will take about 30 minutes. You do not have to answer any question that you think is too personal. If you complete the first survey, you will get a $30 gift card, and if you complete an additional survey, you will get a $40 gift card for each additional survey you complete. If we cannot reach you by phone, we will try to follow up with you in person. If you refuse to take part in the survey, we will call you one last time to ask you about any concerns. A person from Mathematica may also ask you to do an in-person interview or be in a focus group discussion. These could take about 90 minutes. All of these activities are voluntary, but are very important for the study. You will get a $50 gift card for each interview or focus group you complete. Information about your earnings and government services and benefits you get will be shared with the evaluation team by unemployment insurance agencies, employment service providers, and Illinois state agencies that run Medicaid, TANF, and SNAP. The evaluation team will collect this information for a period that covers up to 7 years, beginning 2 years before today and up to 5 years after today. The evaluation team will hold this information for study purposes only for up to 10 years. SNAP ENT and Epic SNAP ENT service providers, as well as employers, will give the evaluation team information about you and about your participation in employment and training services. This includes information about program assessments done in the year prior to study entry, the training and support services you got, the cost of the services, and information about jobs you got during and after the program. All information the evaluation team gets about you will be used for research only. The information will be kept private unless the law requires otherwise. Your name will never be used in any reports, and no information will be reported in any way that can identify you. Your next steps include, at the meeting with your case manager, receive answers to any questions you may have about this study. Complete a checklist about what you just heard. Make a decision whether you want to participate in the study. If you agree to participate, answer questions about your background. And finally, learn which group you were selected for and hear your next steps.